I'd now like to demonstrate for you what is referred to as an Epley maneuver for treatment of what we'll assume to be left-sided posterior canal canalithiasis. Now, in order to execute this technique, what we need to do is orient the posterior canal vertically up against gravity. And so it typically sits off at a 45-degree angle here in this orientation. So what we're going to be doing is rotating her head 45 degrees to the left, and now the left posterior canal is vertical or in the plane of gravity. Next, we're going to ask our patient to maintain this head position as we'll now ask them to lay down. Now, there are two different ways to allow your patient to go down. For patients who have poor mobility or poor trunk muscular control, I'll typically come in front of them here and I'll hold their hand right here, or their head, pardon me, in my hands, and I'll ask them to drape their hands over my forearms. All right? And then we'll lay down as so. So that's one technique to execute the Epley to begin with. This is also the Hallpike-Dix test position. But let's go ahead and come back up. All right? One of the issues with that position, though, is that you may get torso rotation, which changes the relative head position. So for a younger patient, such as the one that we're dealing with today, what I like to do is ask them to rotate their head 45 degrees to the left, all right? And I'll ask them to go ahead and lay down flat on their own while maintaining this head position. So go ahead on the count of 3. Let's have you lay back. 1, 2, and 3. She goes straight back. I have her head in my hands. Allow the head to drop back about 20 degrees of extension while maintaining that 45-degree rotation. What we'll be doing is asking the patient to stare at our nose while we're visualizing any nystagmus that may be present. Allow the nystagmus and the symptoms to cease, and then double the duration. Assuming that the duration has been doubled at this point, what we're next going to do is do a left-sided canalith repositioning maneuver or a left Epley treatment. Both terms can be utilized interchangeably. In order to do that, we're going to rotate the head 90 degrees, and now she's assumed a 45-degree cervical rotation to the right. Again, we're going to ask the patient to hold this position and assess for any change in her symptoms. If symptomatic, again, double the duration. Next, we'd ask our patient to bend up at their left leg, which she's already done, and in this next position, we're going to ask them to roll directly onto their right side. What I like to do is switch my hand position here, because we're going to be maintaining the same cervical position, meaning that the patient's nose, when they lay on their right side, will be pointed towards the plinth. So go ahead and roll over onto your right side. Go, 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 go. And we hold that same head position. And again, assess for any symptoms, whether they be nystagmus or complaints of vertigo. It's not uncommon for them to be vertiginous in this position, and in my opinion, that's actually a good indicator of treatment success. Same thing, double the duration of symptoms, and after this, we're going to ask the patient to sit straight up. So grab onto my forearms, kick your legs forward, sit straight up. You can hold them in a head neutral position or potentially slightly flexed to 20 to 30 degrees, and again assess for any symptoms. That's how you can execute a left-sided Epley maneuver.